Hello everyone and welcome to the UBC Talks webinar. Today we are talking about ensuring water safety from hazardous substances. My name is Maria Andreeva. I work at the Union of the Baltic Cities Sustainable Cities Commission, and I will briefly introduce you the background of this webinar series. But first, some practical information. This webinar is recorded and will be uploaded to our website and YouTube channel after the webinar. And your microphones are muted by default, but at any point of the webinar, you can send us your questions throughout the question box that you can find in the bottom of the GoToWebinar control panel. All questions that you will send us will be addressed in the Q&A session that we will have in the end of the webinar after all of the presentations. And a bit about the UBC Talks concept. Union of the Baltic Cities is a network of cities around the Baltic Sea working together to foster their smart, sustainable and safe development. And there are several commissions within UBC, each focusing on a particular side of the city development. And our Sustainable Cities Commission works with climate change adaptation, water management, energy efficiency, urban mobility, urban planning. The UBC Talks monthly webinar series were launched in January 2020 to discuss relevant challenges that the cities face under these themes and to exchange best local practices. Today we talk about water. In Sustainable Cities Commission, we are leading a platform BSR Water, bringing together both organizations and also existing transnational projects for the smarter development of the water sector. Hazardous substances are one of the pillars of the topics that we deal with in this platform. And today we are very excited to hear about different approaches from strategy to practice to address this challenge that have been developed around the region. I will stay here for the technical support of the webinar, and I'm very happy to give the floor to the moderator of today's UBC talk, Stefan Rettig from Technical University of Berlin. Stefan, please tell us a bit here about yourself and what are we going to hear about today?
Yes, good morning. My name is Stefan Rettig. I'm working at the Technical University of Berlin as a research associate. We have a long-term connection to the Union of the Baltic City Environmental Commission. We have been implementing a couple of projects already together, and we are also a partner in this BSR Water platform. And yes, for today, we have 3 presenters, and they will all give their presentations in a row, and then afterwards we will have a short Q&A session. So please, whenever you have a question, write it to the chat, as Maria already said. And yes, I don't want to have a long talk. I think we can just go right into the topic. And I want to introduce the first presenter, Emma Undeman. She's a researcher at the Stockholm University Baltic Sea Center. And yes, she has been doing research about micropollutants or hazardous substances, I think, for quite some time. And we also have a link that she's also connected to our BSR Water platform. And I'm quite curious about her presentation. So Emma, please, the floor is yours.
Okay, thank you very much for inviting me to give this talk. As you said, I work at the Stockholm University Baltic Sea Center, and today I will talk about a project where we've been mapping micropollutants that are emitted in the Baltic Sea catchment via municipal wastewater. And I've done this together with my co-workers, Kristina Rasmusson, who's also at Stockholm University, Matti Leppinen in Finland, Ksenia Pazdro in Poland, Ilga Kokorite in Latvia, and Martin Mørk-Larsen in Denmark. So as you all are aware, surface waters are impacted by so-called micropollutants, and that's basically anything that's not a nutrient. So it can be, for example, industrial chemicals and the byproducts from industrial processes. It can be chemicals in finished articles that we use in society. Other examples are pharmaceuticals, household chemicals, ingredients in personal care products, and pesticides. All these are examples of micropollutants that are found in surface waters in Europe. And there are many different pathways for these micropollutants to reach the waterways. If we take the Baltic Sea as an example, chemicals can reach the sea via atmospheric deposition, river transport, but also from point sources at the coast or in the open sea. And wastewater treatment plants are actually important collection points for various chemical flows in our society. So the pollutants are collected in the effluent or sludge of the wastewater treatment plants. Can actually say that another example of such a collection point for diffuse sources are landfills. So that's another example. So how can chemicals reach the wastewater treatment plants? Some ways are more intuitive than others. Obviously, we sometimes dispose of chemicals in the toilet or the sink that we're not supposed to do. But we also use different kinds of, for example, personal care products and that are washed off our bodies when we take a shower. We wash textiles that are treated with different chemicals that are then released and enter the sewers. Obviously, we do take pharmaceuticals, and in many cases, quite a large fraction of the pharmaceutical ingredients are passed through our bodies quite unaltered and are released to the sewers also. Another issue that is quite much research going on is how chemicals absorb or adsorb to dust, which may then enter the wastewater flows. For example, when you wet wipe surfaces. And municipal wastewater treatment plants, they collect wastewater not only from our households, but also from smaller industries, workplaces, and public buildings. And in some wastewater treatment plants that are combined systems, also stormwater is treated. And that brings a lot of different micropollutants that are washed off from urban surfaces. But conventional wastewater treatment plants, they are designed mainly to remove nitrogen, phosphorus, and reduce the biological oxygen demand of the wastewater, so to remove organic matter. And so they are not really targeting these other types of micropollutants. But actually, many micropollutants are quite well removed anyway during this treatment process. So what can happen to these chemicals when they enter the treatment plants? Well, they can be adsorbed or absorbed to particulate matter that then sinks and becomes sludge in the wastewater treatment plant. They can also be lost via volatilization, or they can be degraded either abiotically, for example, via hydrolysis and photolysis, and they can also be biotransformed by the multitude of microorganisms that are present in wastewater treatment plants and contribute to quite efficient biological degradation. But some chemicals are typically not so well removed in conventional wastewater treatment plants. And these are in particular those that are highly or relatively persistent and are not degraded, and mobile, meaning that they do not really sorb to organic matter. So they are stay in the water phase. But you can of course also get large outputs of other chemicals if you have a very large input. For example, many pharmaceuticals are examples of chemicals that are quite well removed in the wastewater treatment plant, but you still have quite enormous emissions simply because we use a lot of them. So our project then that I will talk a little bit about today, the ChemPact project. We are interested in to know what's in these effluents from the municipal wastewater treatment plants. The question is really how important are these as entry routes for different kinds of micropollutants compared to other input pathways? And to answer that question, the first step is really to try to see which chemicals are actually present in effluents that are emitted in the Baltic Sea catchment. which concentrations have been observed and which chemicals are present in highest concentrations, and can we estimate the loads from municipal wastewater treatment plants. So that is partly the purpose of this project, which is a literature study. We have compiled data on measured concentrations of metals and organic chemicals from municipal wastewater treatment plants that are located in the Baltic Sea catchment. So the area where water is transported to the Baltic Sea in the end. We have compiled national monitoring data, also looked into the scientific literature for studies that present such data, and also looked at the grey literature as far as possible. And this is a very difficult task because there are so many different chemicals, of course, that one can study. And but we have done our best to get as broad range of micropollutants as possible. And right now we have data from about 725 municipal wastewater treatment plants that have been sampled at some occasion. Only 640 of these we actually know which treatment plant it is, because it's not, when you publish this kind of data, it's not always that it's shared which treatment plant that was actually sampled. It can be just a treatment plant in Poland, or not more specific information than that. And we have about 70,000 entries covering about 1,100 unique substances. And these wastewater treatment plants that we have data for, where are they located? This map shows, the stars shows different wastewater treatment plants that we have data for in the database. And we can see that it's quite many treatment plants in Denmark and Sweden and Estonia, but a little bit less coverage in Poland. We had difficulties getting data from Poland. And that is quite important because now the map shows also all wastewater treatment plants that are in the EU water base database. And we can see that Poland, of course, have a huge population and therefore many wastewater treatment plants. So we can see that there's a lack of data from this region in our database. We had a little bit of a look at what kind of data we have now here. What kind of chemicals have been analyzed in this region? We categorized all chemicals that we have in our database roughly into a few main categories. Pesticides and pharmaceuticals and metals and inorganic chemicals are quite easily categorized, but many chemicals, of course, have several different use areas. So it can be hard to say what a chemical is actually used for. So we can say that the industrial category is a quite broad category of various substances. And that is also the kind of chemicals that are most often analyzed, or the largest number of chemicals are analyzed in this group. But we also have many pharmaceuticals and pesticides data for these kind of substances. If you compare data for different countries, how many different chemicals have been analyzed in the different countries, we can see that Sweden to the left here in the bar diagram sticks out a bit. Almost 800 individual chemicals have been analyzed. And in the other Baltic Sea countries, it's much lower. We didn't have any data for Russia, by the way. But you can see here that Sweden has a broad range, and I would say that the main reason for that is, or one reason for that is at least that Sweden has reoccurring screening campaigns as a part of the monitoring program. So in addition to regular monitoring of a few substances, Sweden do screening campaigns looking for chemicals of emerging concern, different the categories. And it's quite often that these screenings are made for wastewater. So that gives us a lot of data of a broader range of chemicals in the wastewater. We were also interested in how often these chemicals are detected? How often do you actually find what you're looking for? And we had a look at the different categories of chemicals and can see that, well, overall, 43% of the entries in the database are concentrations that are above the detection limit or the limit of quantification. But I call this detection limit in this presentation. And we could see that for pesticides, it was quite often so that the chemical that was analyzed was not detected in the sample. We also compared different countries. And we could see that also here it was a difference how often chemicals were detected. So in Poland, Sweden, and Denmark, they were quite high, and Latvia, they were quite high detection frequencies. Whereas in for example, Lithuania and Estonia and Germany, it was quite common to analyze but not find the substance. And there can, of course, be different reasons for this. Either you look for chemicals that are simply not there, perhaps they are banned or they are not used so much. But it can also be because the methods that are used have high detection limits. So there can be various reasons for these differences. And of course, which type of chemical you commonly look for. We could also see that quite a few substances make up a large share of the entire database. We can see that about 20% of the total number of unique chemicals in this database actually contribute about 70% of the total number of entries. So the same chemicals are measured over and over again, and the same has been observed also in a previous study looking at which substances that are analyzed in Baltic Sea fish monitoring. And in that study, they actually found that 20% of the substances were responsible for 87% of all entries. So that data set was less diverse than the one for wastewater. Okay, so we have a little bit of an overview of what kind of chemicals are in this database. We also want to aggregate this data, calculate representative concentrations and try to estimate loads that are emitted from the wastewater treatment plants. But how can we calculate this? There are quite many hurdles to do this. For example, what do you do with all the concentrations that are reported as under the detection limit? There are different ways to treat such data points. A common way to do it is, for example, to assume that the concentration is then half the detection limit. But this has consequences for your calculated average value. And also, what type of aggregated value is best to calculate? Is it a normal arithmetic average or a median? Perhaps a geometric mean that takes off the high influence of peak values or extreme values? Should we weight the aggregated values to something? For example, let the size of the wastewater treatment plant be important for how much a certain wastewater treatment plant contributes to the aggregated value. So give the larger treatment plants a higher influence on the average, for example. And we also have to decide which years to include. The narrower time span you include, the fewer data points you have. But on the other hand, if you take only for recent years, it's more relevant to the situation today. So you have to make a decision there, how far back in time to go. And also when we try to do an upscaling of calculate the total load in the entire Baltic Sea region based on concentrations from a limited number of wastewater treatment plants. Can we actually do that? Should we have a limit for how many countries a substance must be measured in, or at least a minimum number of wastewater treatment plants that should be analyzed before we do this calculation at all? The problem is, of course, that there are different substances analyzed in different countries, so we have not a consistent data set. I will show you just an example of how these different decisions influence the estimated load. If we look at the pharmaceutical diclofenac, for example, and estimated emissions to water in Sweden, this bar graph shows the different amounts, kilograms per year, that are estimated depending on how you treat the detection, the data under detection limits, if you calculate the mean, median, or the geometric mean, if you weigh the average value to population equivalence, or the, for example, the treated volume of wastewater. And you can see that depending on these assumptions or the methods you choose, these estimated emissions range about a factor of 4. We can also compare this to the left. The gray bars here show another study that calculated diclofenac emissions from sales data in Sweden. And we can see that the emissions that we can estimate in this study are in the same range as those from that study. And to make it even more complicated, if we include the time factor here, which years should we include? We can see that in this data set, there are apparently higher concentrations of diclofenac measured in Sweden after year 2013. So if we include only the most recent data, we estimate much larger emissions in Sweden. And now we suddenly have a range of a factor of 6 to 7 in difference of these different estimates, depending on assumptions. So that's a difficulty. But we also wanted to look a little bit about at concentrations for different types of chemicals, different groups of chemicals. So we have divided the data set in these household and personal care ingredients, chemicals, industrial chemicals, and so on. And we can see that the range of concentrations in each group is huge, it's several orders of magnitude. And they overlap a lot. So it's you can certainly have a pharmaceutical or a pesticide or industrial chemical at the same concentration level. We can see that dioxins and PCBs are in general in very low concentrations compared to other types of substances that have been analyzed. But this is a log scale here. If we take off the log scale from the graph, we don't see so much, but we can see that a few chemicals really have huge concentrations in this database. So, for example, just a few industrial chemicals have concentrations in the microgram per liter range. And that, if you do the emission estimates, there are huge amounts emitted if you use these concentrations. And the type of chemicals that defined at the top here with the really high concentrations are, for example, if you look at the household and personal care products, you have huge amounts of sweeteners and the different kinds of ingredients in shampoos and creams, and also UV filters appear at the top here. For the industrial chemicals, you have they are quite a heterogeneous group, but sometimes you see in the top quite often organophosphates, phthalates, and fluorescent whitening agents show up. And also a lot of phenolic substances have very high concentrations in the effluents. And looking at some pesticides, we both have current use pesticides and such pesticides that are not in use anymore. For example, glyphosate and the degradation product AMPA are found in very high levels in many wastewater treatment plants, and also DEET, a common insect repellent, but also older types of pesticides that are strictly regulated or even banned, like diurone and alachlor and endosulfane are found in high levels in the effluents. So a few substances are really responsible for a very large share of the total load. For example, if we look at pharmaceuticals, you can see that the estimated emissions are very high for 15, 20 pharmaceuticals, and then the rest at the list are not contributing so much to the total mass that is emitted. And at the top, pharmaceuticals that are present in the microgram per liter range in different countries. It's commonly pharmaceuticals, well-known pharmaceuticals such as diclofenac and carbamazepine, for example, that are also found in the Baltic Sea coastal zones and in the open sea. But it's of course toxicity. It's of course also a matter of toxicity. It's not only a matter of how high concentrations naturally, and we don't study this ourselves in this study, but we can have a look at the previous studies. For example, this one by Gustafsson and Backhaus from 2017, where they compared the environmental thresholds like PNEX for industrial chemicals and pesticides and pharmaceuticals, and then used data from REACH registration dossiers for a large number of industrial chemicals. And they could see that in general, industrial chemicals are less hazardous compared to pesticides and pharmaceuticals, which is quite natural. But on the other hand, quite a large number of industrial chemicals are as toxic or more toxic than the medium pesticide. And one should remember that pesticides are actually designed to be toxic to living organisms. And the same goes for pharmaceuticals that are designed to interact with biological systems. But still, many industrial chemicals are actually quite toxic, and they are also in many cases used in very high amounts. So to sum this up and make some conclusions from this study, we have this database now compiled with a large number of micropollutants and their measured concentrations in effluents. And we can see that relatively few substances make up a quite large fraction of this database, and that it's actually more common to not detect what you're looking for in the wastewater than to detect it. We have 43% detection frequency overall in this particular data set. And there's a very large variation in the aggregated values, different types of averages, depending on how you calculate it. And this makes it difficult to estimate emissions. You get a quite large uncertainty range. But we can see that a limited number of substances are responsible for a quite large fraction of the emissions. But on the other hand, large emissions can compensate for a relatively lower toxicity of, for example, industrial chemicals. And we are still working with analyzing this data set. And just to give you a little outlook on how this fits into the larger perspective, in Europe, we of course have the Urban Wastewater Directive, but micropollutants are not really included as a criteria for wastewater quality in this directive, which is old from the beginning of the 1990s. But now this directive seems to be under revision, and the question that is interesting to follow now is if such criteria will be developed. Will there be requirements on micropollutants in wastewater before it's emitted? Will even more advanced treatment technologies be demanded or encouraged in this directive if they change it? You can also note that the major chemicals regulation in Europe, the REACH regulation, does not identify persistent and mobile substances as hazardous in the criteria used currently to identify, for example, substances of very high concern. And these are the kind of chemicals that typically escape a wastewater treatment plant. But now, a few weeks ago, the EU Chemical Strategy for Sustainability Towards a Toxic-Free Environment was presented. And there it was stated that this PMT and VPVM, so persistent, mobile, and toxic, and very persistent and very mobile, will be introduced as a criteria to identify hazardous substances. And that is, again, chemicals that are typical to escape municipal wastewater treatment plants. So that was all I wanted to say today, and I thank you for your attention.
Thank you, Emma, for this talk. And I think you presented very nicely the data available and your work that you've been doing. In the meantime, we received a comment that there's a study in Poland about pharmaceuticals, so we will share the links with you, so maybe that's also some additional information. So if you have any other questions, please write them to the chat and we will discuss in the end. Emma will take a short break and then she's ready again. So now I have the pleasure to introduce our second presenter, Vallo Kõrgmaa from the Estonian Environmental Research Center and also engaged in the Estonian Waterworks Association. And he will talk about discharges from industry mainly, I hope so. Vallo, the floor is yours, please.
Okay, thank you. Can you see my screen?
Yes, perfect.
Okay, that's as I was introduced, my name is Vallo Kõrgmaa. My main job is in Estonian Environmental Research Center, but I also work for Estonian Waterworks Association from time to time. And today I talk about hazardous substances. And what's the distinction between? There's actually no distinction between Emma's talk and my talk, because the hazardous substances are like babies like good babies that have quite many names. They can also be called like priority substances, dangerous substances, etc., etc. But in the water environment, what it's most important is that they have certain properties, like they are persistent, bioaccumulative, toxic, and they can act as endocrine disruptors. And why it is important? Because this also defines quite a lot how these substances are behaving in wastewater treatment plant also. When we look at the wastewater treatment plant and municipal wastewater treatment plants, that we can already see that influent is quite often main source of the problems, and quantity and quality are maybe one of the key parameters that cause problems with the wastewater treatment plant. We made a survey in 2016 that covered about half Estonian half Estonian municipal wastewater treatment plants, and to be honest, we have a lot of them because we are quite sparsely populated. And one of the key conclusions from this study was that about 40% of municipal wastewater treatment plants had serious issues with fluctuations in the wastewater load or flow. And industry caused problems for 20% of municipal wastewater treatment plants. So we are talking about 50 municipal wastewater treatment plants in Estonia that have, in one point or other, we had serious problems with industry. One of the key, also important findings was that nutrients are not balanced in municipal wastewater treatment plant, and this is also quite often a good opportunity for the industry because we are lacking quite usually carbon, and there are several industries, especially food industry, that can support the carbon source and thereby boosting a little bit the microorganisms that will do the work or the main work in municipal wastewater treatment for treating wastewater. But on the negative side, we did a survey in 2017 when we looked we looked 9 wastewater treatment plants in more detail and analyzed all priority substances that are listed in EU or Estonian regulations. And we found that only 45 of these substances were not found from the influence. On the effluent side, it was much better, but the problem is that quite a lot of these substances, they should not end up in the sewer system at all. And many of them are restricted. Of course, there were some substances that we could find from old from all the samples, for example, phthalate, toluene, some certain heavy metals, and for some substances, we could see either seasonal pattern or population density pattern. And the population density pattern usually came together with industrial activities that are within the catchment area. For example, the tetrachloroethane was detected only from these municipal wastewater treatment plants that had laundry services, and several of them in their catchment areas. And why it is important? Because the hazardous substances, they actually can come to the wastewater treatment plant via two main sources. One is from the population, and this is the most difficult thing to control, but the other side is the industrial side. And the industry is sometimes relevant, but also can be controlled. And for each substance that we are looking at, that raises interest, we can also actually track down what can be the sources, either from the industrial side or domestic side, but they could be also originating from infrastructure or agriculture or wasteline and landfills, as it was said also by Emma before. And for some of the substances, we already, at least in Estonia, we know where they're originating and how much are the loads that end up in the environment. For example, we know there was an inventory made for energy and oil shale sector a couple of years ago, and we already know that, for example, most emissions of arsenic in Estonia come from energy industry, because we are actually burning oil shale, and it ends up in the air. But still, municipal wastewater treatment plants collect quite a lot of it, and depending how much they can remove, it also ends up in the Baltic Sea. There are several regulations that put the framework together how these substances should be addressed. For example, we have regulations that either restrict the use of substances, or we have regulations that say that we have to be able to achieve certain wastewater or surface water quality. But maybe today the most important regulations for us are Industrial Emissions Directive, which actually defines what kind of industries and how they should be permitted, and of course the Urban Wastewater Treatment Directive, which says that industrial sources in the wastewater or in the catchment area have to be pre-treated so that they do not harm the wastewater treatment plant, because this is also important in quite many cases. And of course, most of these regulations are applied on the national level, and it depends quite a lot of what and how these national regulations are based on. So we will talk about controlling the chemical. Actually, I could say that the REACH and the Stockholm Convention are working rather well, but there are still some buts in there, as you can understand. We can find several chemicals that are either prohibited or restricted with these regulations or agreements in the water, in both sides, in wastewater and in the environment. And there are many reasons for that. And one of them is that still, even though these chemicals are not allowed to be used anymore, there are still some things in the house. For example, I talked to a colleague yesterday, and he said that oh, my grandfather found TGT in this basement a couple of years ago. So I don't know where it did end up, and I didn't ask him also. But still, but on the positive side, we can quite well control the industry, and that can be done either by environmental permitting or by contracting conditions between the industry and municipal wastewater treatment plant. But this process itself, it has actually three parties. If we look at the contracts or regulating the industry indirect discharges to the municipal wastewater treatment plant, because the wastewater treatment plant, the water company and the industry, they make an agreement, but the environmental authorities and or local authorities in some cases also can put some extra regulations in there. For example, environmental authority, if the plant is subject to the industrial emissions directive, that means it is a big plant that we are expecting that it has an environmental impact in one way or another, then environmental authority has to give it the permit to that plant. And it depends on the country how the laws are applied, but in some cases I know that, for example, in Finland, there are quite good restrictions and ways to control. But for example, in Estonia, we had quite a lot of issues because the indirect discharges were not included in the permits. So this can be also varying in big countries. So in the big picture, the first question for the industry in the catchment area should be asked: is this installation subject to the industrial emissions directive or no? If it yes, then it's quite easy, because all Baltic Sea countries are, most of Baltic Sea countries are EU countries. Also, Russia is also implementing the integrated permits at this time. But I don't know how and when they will finish this process. But if the industrial plant is smaller, then depending on the country, there might be integrated permit given to it or other permits. For example, in Estonia, we had quite a lot of plants, including pharmaceutical plants, that had only permits for ambient air or wasteline, but nothing for the water, in case they send their wastewaters to the municipal wastewater treatment plant. And what is the difference between the integrated permit and single permit? The most key factor is that integrated permit is a combination of different permits, and it has to look the industry as a whole. All emissions that can come from there have to be regulated in there. And of course, for these plants that are subject to the industrial emission directive, the PAT conditions have to be applied as well. But in single media, there is only one permit for one environmental problem. For example, if I told you about the ambient air issue, and actually we had serious problems with that, because for example,
if I may interrupt shortly, could you try to switch off your camera, because it seems like the hotel VLAN is a bit
sorry, can you hear me?
Weak. So if you turn down the camera and just speak, maybe we have better quality of the voice.
Okay, sorry.
Thank you.
Okay, sorry. Is it now better? Yeah. Okay, the integrated permits are better in that regard that they are also listing the chemicals that are used in this certain industrial facility. And from time to time, for example, in Estonia, we can see that there are some certain chemicals that are used, but and they are priority chemicals. If you're looking at the water frame directive, but they are not restricted in their, or their emissions are not restricted. And that in turn, for example, ended up in situations where for example, Tyrone, we could see that it is in the industry. We actually knew that it will come to the wastewater, but it were no restrictions applied for that. And that was a problem. Of course, the second way to control the industry is to use the contracts. But contracts are mainly not public, and it's quite difficult to gather information about the contracts. Also, most industries have to get approval in order to discharge the wastewater to the public sewer system, and they have a contract agreement with water company. Most of the contracts are quite often based on just the regular domestic wastewater, and they might have only restrictions for nutrients and pH, but no hazardous substance in there. And we had cases where inhibition tests are needed. For example, if you're sending the wood industry from wood or oil industry to the municipal treatment plant, then you can end up damaging the nitrification process in the wastewater treatment plant. So the pre-treatment is often necessary, but in quite many occasions, wastewater companies do not have enough data to require it, and this is the positive side is that there are quite good guidelines to treat industrial wastewater or how to manage them, and I recommend to go to the best project website when you can see, and actually I would recommend highly to look at the Finnish guidelines that are translated in the English at the moment. But what happens in the wastewater treatment plant when we talk about removal in wastewater treatment plant? We can talk a little bit about volatilization, a little bit about airstripping, but mainly we can talk only about that we are removing these substances from water and we are sending them to the sludge line. So it's important because in one case, we are treating the water, and yes, we are quite capable to do it very well. But the other issue is that all these substances end up in the waste on the sewage sludge line, and they have this sludge has to be applied somewhere. And it's quite often either it ends up in the environment anyhow. And if you look at for the municipal wastewater treatment side, then the treatment itself is a complex process where the effluent quality is strongly dependent on the variations in the influent characteristics, and this we can control only by contracts or by permits. The complexity of technology, and this is actually the easiest to achieve. You can put always more money into the wastewater treatment plant, by more sophisticated technology, but it all comes down to nothing when the influent is not controlled, and if the maintenance and operational decisions are not made. So in conclusion, I can say that many substances that are subject to the international restrictions are still present in raw sewage and treated effluent. And for most of the substances, we can see that they are removed from the water phase in a municipal wastewater treatment plant, but they end up in the sewage sludge. That only indicates that pollutants are often transmitted from water to the biomass. And one of the lines from my side is, please, if you're on the industrial side, please look at all the waters or the liquids that you have in the process, because not all the liquids from industrial production are wastewater, and some of them should be discharged as or treated as hazardous waste, liquid hazardous waste. Okay, thank you.
Okay, thank you, Vallo, for this interesting talk. Yeah, unfortunately, we had a bit of technical problems. So if you have any questions to Vallo, you can post them and we will see if he will still be available for the questions, because he's very busy today. Otherwise, we will send them to him. Okay, we're coming to the last presenter of today's webinar, Monika Piotrowska-Szypryt, Head of Promotion and Environmental Education Unit in Gdansk Water Utilities. And I think, Monika, you are bringing a very practical approach working with the people in NonHazCity project. So, Monika, the floor is yours.
Thank you, Stefan, for the invitation, and thanks to UBC for the invitation to give this presentation. My name is Monika Piotrowska-Szypryt, and I work for the Waterworks company, Gdansk Water Utilities, and I was the coordinator of the City on Detox campaign that was organized within NonHazCity international project. The project goal was to minimize the emission of hazardous substances from urban areas into aquatic environment. And the project consortium consisted of 18 participants, 18 partners from 7 different countries, and our company was one of those project partners. We plan all our activities in the project basing on the assumption that hazardous substances are present everywhere. They can be found in food, in single-use plastics, in toys, in cosmetics, cleaning agents, and so on. So we wanted to prove that they are present and that they can be harmful for our health. Okay. And one of the most crucial and commonly present substances among this group of hazardous substances are endocrine disruptors. And we were trying to focus mostly on them because these compounds are similar in structure to human hormones, which means that when they enter our body, they can disturb the work of hormone system. On this slide, I listed the 4 basic endocrine disruptors, and they are mostly added to plastic items, and these are like phthalates, bisphenol A, and its other forms like bisphenol S and F, brominated flame retardants, and also per and polyfluorinated alkyl substances. In this slide, I try to put the information what kind of properties each of those substances give to the plastic, but also in what kind of products they can be found. And as I said, these endocrine disruptors are important because they can cause a lot of serious diseases, like, for example, obesity, metabolic disorder, diabetes, allergies, cancer, also polycystic ovary syndrome or fertility disorders, and many others, of course. But it is about the human health. But when those substances reach the environment, they cause environmental pollution, which can have a negative impact on wildlife and can cause some of those diseases also to marine organisms. there are some, the hazardous substances can reach our body through all possible paths. So it can be via direct contact through skin, when breathing, but also when drinking and eating contaminated food or drinks. And what has been already said, when using products containing hazardous substances, we can cause the emission of those compounds to the environment via wastewater. So when we, for example, use cleaning agents or we wash off cosmetics, they reach the sewage and then the sewage system. And also inappropriate waste disposal can cause the leakage of those substances into the environment. Coming back to the project, we aim to eliminate hazardous substances, as I said, but at the very beginning we had some doubts. Is it possible to avoid hazardous substances? What can we do about this problem? Isn't it too late to save our health and the environment? Where to look for necessary information and if they are available, and also where to search for eco-friendly alternatives? And can the possible changes be effective? But we decided to focus on small steps and to prove that behavior changes at the source can really make the difference, because we were trying to follow the rule, think globally, act locally. So the main part for each project partner in the project was to organize the campaign. And if someone wants to have a good campaign, you need a good strategy. And our strategy was based on activities planned for all project partners, but also on our everyday activities and cycling events. The strategy has to have a catchy slogan, and we decided to have it like City on Detox. So this is our slogan of the campaign. You need a face, so the famous, well-known person that represents the campaign and speaks its own words for the campaign. And also you need the participants. So in order to gather some participants and to do some special activities with them, we started the recruitment process. And finally, within the process, we received 24 applications from 24 families, and we decided to cooperate with 9, and they were represented by 26 people, both children and adults. We planned our campaign, and especially this pilot study with the volunteers, for the half a year. So it is not only the point to gather the volunteers, but also to keep them during this, keep them active and engaged during this half a year. So we decided that our pilot has to be attractive, helping, professional, easy, effective, giving confidence, assuring incentives, and giving feedback, which we found as a very important part of the pilot study. So to have it attractive and helping, we organized the workshops for our participants. And during those workshops, we were trying to give the participants the certain information, some knowledge. We also try to show them where to look for eco-friendly alternatives, or how to do those products at home themselves. And each month, the workshop was dedicated to different kind of products, like cosmetics, cleaning agents, textiles, or even toys. To have it professional, we started to run the Facebook profile under the name of the campaign, in Polish, of course, and it is still running on. It is open for public. I do regret that it is in Polish, so only Polish, the people knowing Polish language can follow it. But Anyway, there is a lot of interesting information on this profile. And also we started the closed group on Facebook, assisted by experts. So it was only for the volunteers, and it was the place for them to exchange the information, to ask questions, to solve their problems. So that was the platform only for the volunteers. To have it easy and effective, we tried to provide our volunteers with simple recipes. To give them information about sub-products, to do some items themselves, and those sub-products we decided that they have to be easy available and cheap. And also the advices were not only during workshops or on Facebook profile, but also in some guidebooks and brochures that we produced. Giving confidence, it is also a very important part of the pilot, and we decided that we should act together with our volunteers. We didn't want to be someone behind the email or the mobile phone. So we visited their houses, we did the household checks. So we, room by room, we checked what those participants have at home, what kind of products, what kind of hazardous substances, which should be eliminated, removed, or replaced, and with what. So we try to keep the constant contact with our volunteers. And assuring incentives, this is always very important for people, because when they act and when they do something, they would like to receive something. So we prepared project t-shirts, cotton bags, a memo game for children, but also stickers for them to mark the products that they did themselves. And at the very end of the pilot, we also organized the final celebratory gala, just to thank our participants for their engagement in the project. And the last but not least, and as I said, the very important part was to give them feedback. So we decided to analyze urine samples from all participants, but also dust samples from their homes. And we were focusing on endocrine disrupting chemicals in those analyses. And also we asked them to fulfill the questionnaire just to find out some correlations between their lifestyle and the results of analysis. And the analyses were done at the very beginning of the pilot and after this half a year. So at the very beginning, we realized that endocrine disruptors were present in 100% of the samples, which was not surprising, but anyway, could have been different. But after this half a year of changes that those participants did, the endocrine disruptor level decreased, and in many cases it decreased to the undetectable level. So it was really nice. And on this chart, you can see the fact that those levels decreased. Every two peaks represent the same substance before and after the pilot. So, and this is the average of the analysis. And as you can see, in all cases, the levels decreased. But there is always a but. We also find out some correlations. For example, in urine samples, higher BPA was observed in samples from people that, for example, have a frequent contact with paper bills. Higher endocrine disruptors, generally speaking, represented people eating food from plastic packages or boiling rice in plastic bags. And for dust, for example, Higher phenols were in the rooms with a lot of electronic devices or plastic furniture, and higher phthalates in rooms with plywood furniture, PVC flooring, or the rooms with a lot of plastic decorations. And we received in the pilot studies what we wanted to receive. So we got the proof that the hazardous substances are present, and that the small steps can make the difference. And this is the story by one of our volunteers, which is a good summary for this pilot studies. And I would like to read it for you. Sunday story. Why replacing domestic detergent with ecological alternatives makes sense, by Veronika Gasperczak. For 1 week now, I've been alone with my daughter at home. This means that my energy resources are rather poor, and while being tired, I can make stupid mistakes by coincidence. Yesterday, I was cleaning my kettle from the scale, but I forgot about that. Not for long, I remembered when I poured the water from the kettle into the bottle for my child, and I tried it just to be sure that the temperature was okay. Fortunately, it was only water with a citric acid instead of the descale product available on the market. So this story speaks for itself, and this is the success of the pilot. Just coming to the end, I would like to say a few words about the NonHazCity 2 second stage, because the value of the first stage was noticed by the financing institution, and we managed to get the money for the extension phase. And in NonHazCity 2, we concentrate on the tools that can help people to measure the hazardous substances exposure and to eliminate hazardous substances from their lives, but those tools can help them to do it themselves without not so many advice from the experts and specialists. So we managed to produce new interesting brochures, also some videos that help to eliminate the substances from our homes, but also at the offices. And brand new is the internet and mobile phone app, which helps to measure the exposure to endocrine disruptors. And at the end of this app, of this kind of questionnaire, you get the results, but you also get some personal recommendations. And just a small hazardous substances summary. As I said, they are everywhere. They can be found in many everyday life products, including, unfortunately, toys and children's items, often in alarming concentration. They can have negative impact on our health and on the environment. And although the pilot studies prove that hazardous substances are present in human bodies, their levels can be reduced by changing everyday life habits and consumer behavior. I have to mention that many companies ensure that the level of chemicals in their products comply with the regulation, and that is true. However, they do not take into account that we receive many small doses from different sources, which is so-called combined exposition. So it is not the point only of this small dose from one product, but it's about the entire exposure during day by day, week by week, and year by year. So it's really better to eliminate than to accumulate. And it's never too late to search for the information, because it is available and you can just do it yourself. So thank you for your attention. I would like to invite you to encourage you to follow the project website. Every partner has its own website in their language, so we also have the Polish one. And on those pages, on those websites, you can search for the information, download all the materials, which can help you to change your life for better health and the environment. Thank you.
Thank you, Monika, for your talk. And yes, I think now we can immediately go to this question session. I invite Emma also to come back, and also Monika, please stay for the discussion. And if Vallo is still around, please also join the discussion. Okay. So, yes, thank you all for your interesting presentations. I think we have touched quite many important points in this broad topic of micropollutants and pollutants. And the first question that I want to ask goes to Emma, maybe first. So, are there similar rules in the European Union for identification, frequency, and types of the substances that have a significant negative impact?
What do you mean?
I guess this is regarding the monitoring. So you said that in Sweden you have the regular, very broad monitoring of the wastewater. Do you know that if there's similar requirements in other countries?
Oh, well, in Sweden there's some monitoring. I don't know exactly what is monitored, but that's a much. It can be also in sludge that chemicals are monitored. But the thing that Sweden does that I noticed that is not so common, at least not in the Baltic Sea nations, is to do these screening campaigns. That is a temporary campaign when you look unprejudiced for new chemicals, basically, that you suspect may be in the aquatic environment or in humans or in wastewater, for example. So that is a way to identify new chemicals that should maybe be included in the monitoring, in the regular monitoring program, or be prioritized somehow in other ways. But there have been screening campaigns also in Baltic Sea countries. For example, looking for chemicals that are prioritized under the Water Framework Directive. Those kind of projects have been performed, but it's just that in Sweden it's done more often, and we could see in the data set that has generated a lot of data on chemicals that are not so often analyzed in wastewater. But I don't know. I don't know about the rules or anything for this kind of activity.
So maybe that is something that will be introduced on a more regular basis when our EU directives are advancing more.
Yeah, that would be a good idea to use this opportunity to have a. I mean, there have been such campaigns has been at EU level also, and I know that the Joint Research Center, the EU's research center, has done this kind of campaign when they sample. It was something like 90 different wastewater treatment plants, and then analyzed in the same laboratories. So they had a consistent data set. Now we compiled data wherever we could get it, and so then of course it's more heterogeneous, different labs, different types of sampling, even different. I didn't mention that, but it's not always the same fraction that is analyzed. It can be the total concentration in the wastewater or the dissolved concentration, for example. So it's good if these kind of campaigns are organized to get a consistent data set that makes it much more easy to compare the results. Otherwise, you just have information regarding one wastewater treatment plant, and that doesn't tell you so much for just one plant alone.
Mm-hmm. Do you, by coincidence, have any information about wastewater treatment plants that already address at least parts of these micropollutants and
you mean
the benefits? Yeah.
Do you mean that have implemented more advanced treatment technologies? Yes. Yeah, I know that there actually I don't think there's so many in the Baltic Sea catchment, but in Sweden There are a few that have been, for example, in Linköping, they have in a full-scale facility with ozonation, and there are other that has come after Linköping that also, because Sweden has, the Swedish government has provided funds for municipalities that are interested in upgrading their treatment plants. So they have provided some funds to do either pilot studies or to actually do do the investments to introduce more advanced treatment of the wastewater. But still, it's a minority, of course, of the wastewater treatment plants.
And it's a very broad group of substances, so most likely not only one treatment opportunity will help to solve it all. So that's why I think we also need to look at at the sources, or not only at the end of pipe. And maybe now we turn to Vallo. So your project you've been reporting on, this best dealt with industrial wastewaters, and I think that what you mentioned, that it's really important to monitor the industrial indirect discharges, and this is something which should be applied all over the region. But it is, of course, something which has to be or which needs resources as well. So when you have the permit for the industry, then you need also somebody who is like doing the follow-up measurements. How is it implemented in Estonia, or is it going to be implemented?
Estonia is a problematic country on that regard, because we till the beginning of this year, actually, we were struggling to get the indirect discharges into the at least now the Ministry of Environment has promised that this will be changing, and indirect discharges will be monitored. But usually this monitoring obligation is on the owner of the facility, and they have to do it or order it. It can be done in different ways. And this how often has to be launched, and what kind of substances they have to be monitored, that has to be included into the permit. So maybe in that regard, it's better to ask this question for Finnish or Swedish or even German colleagues, because in my opinion, your permits are a little bit better at the moment than in Estonia.
So yes, I know that in Germany we have the situation that at least many substances are controlled from the indirect discharges, but yeah, mainly it has been focusing on like BOD, phosphorus, nitrogen, so the organic pollutants, and also maybe fatty acids that cause problems in the sewers. So when you open up for the micropollutants on the broad scale, it's a quite large range, which is difficult to include in permanent monitoring. So you have to know your special friends and monitor them.
It's actually so and so, because there are quite certain industries have only certain kind of substances. For example, if we in Estonia we have the most biggest industry is oil shale industry, and the list of substances that we can find there is, you can say it's long, but usually it comes down to phenols and certain heavy metals and polyaromatic hydrocarbons, but not that much. So it's this decision what kind of substances should be monitored. It should be made based basically on what kind of activities this industry is involved with and what kind of chemicals they are using, because actually environmental authorities have quite good overview of what has used facilities, and these facilities have to report it as well. And also, well, the same applies to the water company, because they can always ask information about that, and they have to get it. In Estonia, most of the parts, for example, if you look at oil shale industry, the water company is doing the monitoring, and this is a part of their agreement. But we're like in Estonia, we're looking for the second protection for the water, because usually if you go down to the contract, then contract only specifies that if you are over the limits with certain substances, then you get the industry pays fines, but the other issues could be very difficult in the wastewater treatment plant. For example, we had several occasions when there is a biological mitigation inhibited, or even a couple of cases when all the wastewater treatment, all the biological processes in wastewater treatment plant have shut down, basically. But this is fortunately this is not common. Most issues start still with the how much goes to the wastewater treatment plant and how much are they able to get out of the water phase. So.
Okay, so let's turn to Monika now. Monika, I think that your approach is quite interesting. So it's about like really raising awareness for the public, and what can everybody do on his personal level. So how did you find the volunteers, and what exactly did you advise them?
For the recruitment process, first we wrote down some basic criteria. So we wanted to have different families from different city districts, from different houses, like one family houses and big blocks, and also different family shape, so seniors, parents with teenagers, with small children, and we prepared some press releases, and we also asked our ambassador to spread out the information about the recruitment process. So finally we managed to reach, and the interest was quite high, but as I said, we received 24 applications finally, and we choose for the very beginning 10 families basing on our criteria, but finally we worked with 9 of them. Before we make some contracts with them, we also invited them for some talk, just to get to know what was the level of their knowledge in the field, and why they want to participate in this pilot study. So after those meetings, we choose the final representatives to this pilot. And for this half a year, it was like that many things we were learning ourselves. So our level of course it was higher than the others, but some of the things we were trying to practice also ourselves at home. I also changed my personal habits. I started to prepare cleaning agents, washing powders or cosmetics by myself at home. So it was, as I said, it was not only that we were giving advices and waiting for the reaction, but we were also engaged in the whole process.
Mm-hmm. So it can, with our daily lifestyle and products that we consume or use, we can very much influence this, our toxic or non-toxic environment.
Yes, and we were really glad that the results of those analyses proved that when you change your lifestyle, you can change something. Of course, it is only a small step, but anyway, if everyone would do the small step, then we have a lot of steps, and we can change something really.
So yes, I think that's a good closing word already. So this topic of micropollutants, yes, I think I can thank you now also for this question and answer session, and just quickly have a sum up of this webinar. So we had 3 presentations. The first one from Emma Undeman, showing the many results from studies collected into one large database, and they have a very good information and overview at the Stockholm Institute now what substances are around in the Baltic Sea. And I think that you are still going on with this work, so that is very good for creating knowledge. And then we had Vallo Kõrgmaa, who was showing what industries or how industries could be monitored and how their influence could be at least reduced a bit. And we had the last presentation by Monika about the citizens, how to work with citizens and how to raise awareness about toxic substances in our everyday life, and that there is possibilities to reduce their influence on our human bodies or on our environment. I think this whole topic needs all our efforts. It has to be addressed by the industry using as less harmful substances as possible. Of course, we should do our best in the wastewater treatment plants to clean what we can, but there's always the question how to finance this. So I think there could be several webinars also in a row on this topic. So thank you very much for listening, and I'll hand over to Maria. She will introduce, I think, something more to come.
Yes, thank you very much. Thank you very much, our great speakers, for the most interesting and inspiring presentations, and to the audience for all of the questions. As I said in the beginning, this webinar was recorded, so all of the materials will be sent maybe a week after this webinar. And this is not the end for this year. The UBC Talks still have one more webinar to go, so we most warmly invite you all to join us one more time in December for the talk about low carbon energy solutions in cities with the experiences from Turku, Tampere, St. Petersburg, and many more interesting presentations to come. Thank you all once again, and see you around in the region. Thank you.